So our standard of care largely to date for locally advanced esophageal and upper GI tumors has been either preoperative chemoradiation per the CROSS regimen or perioperative chemotherapy per the FLOP4 trial. However, recently we've had our first FDA approval for immunotherapy in the perioperative setting, and this came in 2021 based on the CheckMate 577 trial. We know for patients who receive chemoradiation and undergo surgery, if there's evidence of residual cancer or cancer that hasn't completely been eradicated with chemoradiation seen in their pathologic specimen, these patients have a higher risk for relapse and worse survival, so they're a high-risk group. The CheckMate 577 trial looked at this high-risk patient group with patients with adenocarcinoma or squamous cell carcinomas who were treated with chemoradiation and surgery but had evidence of residual disease on their surgical specimen. These patients were treated with 1 year of adjuvant or post-surgical nivolumab, which is an anti-PD-1 immunotherapy, or with placebo. The findings of the study revealed that the disease-free survival was almost doubled in patients who received adjuvant nivolumab, and this led to the FDA approval in 2021 and is now a standard of care that we offer patients after chemoradiation, especially if they have residual disease in their pathologic specimen. There are other trials ongoing today looking at whether there are other roles for immunotherapy in the perioperative setting, whether it be combining it with chemoradiation or combining it with perioperative chemotherapy. And these results are eagerly anticipated, and we may see that it will change our standard of approaches in the future as we obtain more data.